A vasectomy is a permanent form of birth control, but people can change their mind. Watch this video if you want to learn how to have a baby after a vasectomy. I'm Dr. Lora Shahine. I'm a fertility doctor, and a lot of my patients want to have a baby after a vasectomy or after their partners who had a vasectomy. People can change their mind. Vasectomies are common. About 500,000 men in the United States get a vasectomy each year, and studies show about 7 to 10% of men change their mind. They want a baby later in life. And so patients are saying, all right, how do I do it? Remember, a vasectomy is a simple procedure. It's an outpatient procedure in which the vas deferens, which is a tube, is disrupted. This is the tube that carries sperm from the testicle through the reproductive tract and out in the ejaculate. And so if that tube is disrupted, you can still have an ejaculate. There's secretions coming from the prostate gland and seminal vesicles, but if no sperm is getting out in that ejaculate, it's a wonderful and very effective form of birth control. It's important to realize that even if no sperm is coming out of the body, that the sperm is being made in the testicles. It's being made and it's getting reabsorbed, but it's a birth control method because it's just not coming out in the ejaculate. And so if someone wants to have a baby after a vasectomy, it can still be possible. You just have to figure out how. So how do people have a baby after a vasectomy? Well, there's 3 ways. Well, number 1, the vasectomy didn't work. Okay, this is really rare. And I did say it's a permanent form of birth control, but some studies show that about 1 in 1,000 vasectomies fail, in that there's still some sperm getting through the vas deferens and coming out in the ejaculate. And that's why after your vasectomy, your urologist, your doctor is going to ask you to do a couple of semen analysis after the vasectomy to really make sure that there's no sperm coming out in that ejaculate. So in my personal practice, when I've seen vasectomies fail, more than often, the person just did not get that follow-up semen analysis, and they just assumed that there was no sperm in the ejaculate. So don't skip that part. But for the vast majority of people that get a vasectomy, they work. It's a wonderful form of birth control. So then in those cases, how can you still have a baby? Well, there's really 2 options. Number 1 is a vasectomy reversal. So actually fixing the tubes, kind of putting the tubes back together so the sperm can come out in the ejaculate. And the other is actually aspirating the sperm directly from the testicle and using it to help people get pregnant. But that requires in vitro fertilization. And that's what this video is really about. It's kind of, if someone has a vasectomy, should they get a vasectomy reversal, or should they just get a sperm aspiration and use that sperm with IVF? And those are 2 big choices, and there's pros and cons of each. In this video, we're going to review these 2 options: vasectomy reversal or sperm aspiration with in vitro fertilization. We're going to go through the pros and cons of each, learn a little bit about the procedures, talk about costs, success rates. We're going to discuss how to figure out which one is right for you, steps to get started, and I'm going to leave you with some questions to ask your doctor to really help you figure out your next steps. So let's talk about the vasectomy reversal. So this is a procedure that requires actually putting the vas deferens back together. And there's 2 different main types. There's the vasovasotomy, where you're basically putting the 2 tubes back together. And number 2, there's the vasoepididymostomy. I hope I said that right. It's basically putting the tube back to the structure within the testicle that's called the epididymis. This is like the storage place of the sperm. After it's made in the testicle, it kind of goes through all these little pathways and gets stored in the epididymis. And that's where the sperm that's in the ejaculation kind of comes out of. And so you can actually put the vas deferens, that tube, directly to the epididymis. Now, this is not a procedure that I do as a reproductive endocrinologist. The doctors that focus on these very delicate and careful procedures are urologists. And so that is the person to talk to about which type of procedure. But the basics is undergoing a procedure. It takes a few hours. It takes a highly skilled surgeon to do this. These little tubes, the vas deferens, are so small and delicate that it requires really delicate tools and truly someone that has quite a lot of experience doing this to do this. And again, it can take a couple hours. You're usually under anesthesia. And it's just important to really understand what that process would be like. Now, as far as success rates, you've got to talk to your urologist about your personal success rates. But in general, the best quotes that I could find is about 60 to 70% of the time, the surgery is successful. The tubes are put back together, or the vas deferens is put directly into the epididymis. It stays open, and you have sperm in the ejaculate for months or years after the vasectomy reversal. Now, there are certain things that can predict success or not with this reversal. The three main things to think about are how long the vasectomy has been in place. So the longer it's been since the vasectomy, the lower success rate with reversal. Number two is the age of the person that is having the vasectomy reversal. So the older the person is, then the lower chance of success rate. And then the surgical experience of the urologist that's doing it. So it's really important to ask questions and get background and really understand who is offering this procedure to you. What are the pros and cons of a vasectomy reversal? Well, the pros are if it works, then that's it. You've got sperm in the ejaculate and you can try without assistance. The other option, the sperm aspiration, requires in vitro fertilization, which is a quite complicated procedure for the person with the uterus and ovaries. A vasectomy reversal, you're just putting those tubes back together, sperm is in the ejaculate, and you can try without assistance at home. So if it's successful, you can conceive, hopefully, without any other intervention. And it can be great for if you want to have more than one child. If it's successful and it works for a number of years to come, you could have more than one child with a vasectomy reversal. Another pro is it's typically a lot less expensive than IVF with sperm aspiration. A vasectomy reversal, I saw multiple quotes, but I got anywhere from about $5,000 to $15,000 for that procedure. So the cons of the vasectomy reversal is it really just might not work. So I saw, 30 to 40% of the time, you try your best, but there's just no sperm in the ejaculate after the healing process has happened. And so that is just such a bummer. You go through all this work and cost to reverse the vasectomy, and then it just doesn't work. So don't get the reversal and assume that everything's perfect. So you should definitely get follow-up semen analysis at 3, 6 months, even a year, to really make sure that the sperm is still in the ejaculate. I've just seen with my own patient practice, people assuming that the vasectomy reversal worked, having one semen analysis afterwards, and there was sperm in the ejaculate, but coming to see me after trying for a year or two, and then we do a checkup semen analysis, and there's no sperm in the ejaculate. So the tubes had scarred down later. So just don't make assumptions. The second con is after you have your baby or your family, let's say it works and you guys conceive without intervention, you're going to have to figure out another form of contraception. Vasectomies are an excellent form of birth control. So if you reverse it and you are ready to use contraception again, you're either going to do another vasectomy or find an alternative. The third con is really time to pregnancy. Like, it can take time to get set up with a urologist, have the procedure done, and then a few months, even up to 6 months, to really see good sperm production in the ejaculate to a point where it can cause a pregnancy. So really get a good estimate from your urologist if you're thinking about having a vasectomy reversal. Okay, once I decide that I want to do this, when can I actually get pregnant? You might find that it's about 6 months to a year. And so you have to take into account the whole situation, like the female partner's age and any other fertility issues into account before just assuming that a vasectomy reversal is the right first step for you. So number 4, a complicating factor, and talk to your urologist about this, but with the surgery, like the vasectomy and then the reversal, you can build up sperm antibodies that can kind of affect the function of the sperm and really build up in the ejaculate. It's much more common to have sperm antibodies in vasectomy reversals that are after 5 to 10 years of the original vasectomy. So it doesn't happen in every case, but if there are sperm antibodies, it can make it more difficult to conceive in the future, even without intervention. So talk to your urologist about that. So the other option, if you don't do a vasectomy reversal, is sperm aspiration in combination with in vitro fertilization. So it's important to realize that sperm is continuing to be made, even if the vasectomy is working and the tube has blocked it so the sperm can't be ejaculated. then it's actually, there's still sperm being made in the testicle, and you can aspirate that sperm either directly from the testicle or from the epididymis, which is that sort of storage tube in the testicle. But it's really important to realize that you don't get very much sperm when you do a sperm aspiration, and you need a lot of sperm to conceive with something simple like an intrauterine insemination or IUI. So I have patients that just assume like, oh yeah, just aspirate, get some sperm, and then we'll do the IUI. My patients often call it turkey baster, to just put the sperm in, and then we'll get pregnant right away. Well, it just doesn't work that way. You only get enough sperm that can really be used in combination with in vitro fertilization. That is the process of the female partner, the partner with ovaries and uterus, going through shots to recruit multiple eggs, doing an egg retrieval, to get those eggs out of the body, and then fertilizing the eggs and sperm in the lab under a microscope. So that's a really important thing to understand, that if you do sperm aspiration in order to conceive and have a baby after a vasectomy, you have to combine that with IVF for the female partner, because you just don't get enough sperm to do something simple like an intrauterine insemination. Just like there's pros and cons for vasectomy reversal, there are pros and cons for sperm aspiration in combination with IVF. So the pros are, if the female partner has another indication for IVF, it might make a lot of sense to use a sperm aspiration to get the sperm. So if the female partner has blocked fallopian tubes or endometriosis or unexplained infertility, or just any indication for IVF, advanced reproductive age, it's such a balance. But I really think taking into account the female partner's fertility when you're trying to decide between vasectomy reversal and sperm aspiration, if there is an additional indication to do IVF, you might lean towards doing the sperm aspiration and in vitro fertilization. Number two, remember we talked about sperm antibodies with the vasectomy reversal? Well, that's not an issue if you're doing sperm aspiration. Another pro is that the previous vasectomy or surgical reversal, it doesn't matter because the sperm is being made. So remember, if it's been over 10 years since the vasectomy, or the male partner has advanced reproductive age, then it might be best to do the sperm aspiration because the success rate of the vasectomy reversal might be so low. This is when it's really important to talk to your urologist about your personal situation. And another pro is that it might be a shorter time to pregnancy. It's hard to know. I mean, there's lots of different factors that go into it, but really you're not waiting for a surgery for the vasectomy reversal. You're not waiting for that healing process to see if it worked. And you're not having to try month to month after you know that the vasectomy reversal worked. You're just getting the sperm. And then as soon as the female partner is able to do the egg retrieval, you can create embryos. And I hope that it's successful, because believe me, IVF is not for everyone. It is not perfect, but just if you're thinking about timeline, it might be a shorter timeline to pregnancy if you choose aspiration with IVF. Again, depending on the situation. Cons, well, both partners need to be good candidates for IVF. So there are some people with eggs and sperm, some women who are just low ovarian reserve, poor egg supply, advanced reproductive age, and might not be great candidates for IVF. So before you just assume you're going to do IVF, you should really understand the success rates. Number two, remember, this is a con, but remember, there's a limited amount of sperm that's coming out in aspiration. So it's sort of a one-time try. I mean, I guess you could get multiple vials, and when you're aspirating, talk to your urologist about that, but it's not. With a vasectomy reversal, if it works, you can try for multiple cycles and even multiple years for multiple children. But with an aspiration, you're not getting that much sperm, and it's sort of just to be used with IVF. And number three, a con is it can be more expensive. I mean, IVF, just with the medications and the monitoring and the procedure to get the eggs out, the anesthesia, creating the embryos, whether you do genetic testing, I mean, that can be a minimum of $20,000. With everything combined, could be up to $25,000. And so if you're just looking at those two things, plus the sperm aspiration, a vasectomy reversal, if it works, would be a lot less expensive. So sometimes my patients will actually opt to do both. It just depends on their situation, but they might think, okay, I want to do IVF and do a sperm aspiration right now, and hopefully it's successful. But at the same time, I might do the vasectomy reversal just in case the IVF doesn't work. And then we can keep trying, or maybe with the vasectomy reversal, we could try for baby number 2. I mean, that's a lot. And most of my patients don't do both, but I have just had people ask about it and really take into context family building goals, their age, their fertility history. And so it doesn't have to be either or, but most of the time people choose one or the other. So how do you get started? You now know what the options are, right? It's either vasectomy reversal or sperm aspiration in combination with in vitro fertilization. How do you choose? I think the first step is to really get some good advice. And I would recommend seeing both a reproductive endocrinologist like me that really focuses on female reproductive health, as well as a urologist that focuses on vasectomy reversals and male fertility and reproductive health. I actually really like seeing patients in combination with a urologist because I can look at the female fertility, look at egg supply, look at age, look at overall health and well-being, and really counsel the couple on, based on the female side, what are the chances of success with IVF and sperm aspiration. And then the urologist can really give the best recommendations and resources to the male partner, talking about, hey, this is the chances of success with a vasectomy or reversal, based on your age and how long it's been since the vasectomy. And these are your chances of success. And so I think it really takes a combination, and the fastest way to come to a decision is honestly for the couple to see both a reproductive endocrinologist like me for the female input, and then a urologist that really focuses on male reproductive health to get the male input. And together, we're all on the same team. We all want to help the couple have the baby that they want, but we can really take into account a lot of the different variables and different scenarios to help that couple come to the best decision for them. So let's recap. If you have had a vasectomy and you want to have another baby, your partner's had a vasectomy and you guys want to have a baby together, there are 2 options. Number 1, vasectomy reversal, and number 2 is sperm aspiration in combination with in vitro fertilization. And there are pros and cons to each. They both have different expense. They have different success rates based on both female information and fertility history and testing, and male, how long it's been since the vasectomy, how old the male partner is. And I really think one of the best first steps is to getting a thorough evaluation with both the female-focused reproductive endocrinologist and the male-focused urologist, so that couple can get all the information and really help them come to the best decision. So when you do have these visits, here are some questions to ask your doctors. Number 1, what are the success rates for both options? So once you have all that information, what are the chances that a vasectomy reversal is going to work for me? What are the chances that IVF with sperm aspiration is going to work for us as a couple? Number 2, ask about the costs. Costs vary a lot throughout the country and in different places. And so if you're taking that into account, it's really important to understand upfront what those costs will be for both options. So number 3, ask, what do you think my best chance is? Get an honest opinion from the doctors that you're talking to, taking everything into account, which is the best option for me or the fastest time to having a baby, if that's your goal. And number 4, ask, okay, if we make that choice, what happens if it doesn't work? If I choose to do a vasectomy reversal and the reversal doesn't work, what would it look like? How long would it take to figure out and do IVF with sperm aspiration? Or if I choose IVF with sperm aspiration and it's not successful, how long would it be to book a vasectomy reversal or try something different? So it's just nice to kind of know, even if you make a decision, if it's not successful, what would entail choosing a different option. So if you've had a vasectomy and you're thinking about having a baby, I really hope this video helped you. I want to leave you with one final thought and tip. If you are planning to have a vasectomy, consider freezing sperm before you do it. If it's 7 to 10% of people change their mind, life changes. You find new partners. You could be absolutely certain that you don't want any more kids or you don't want kids ever. But 10 years down the line, something like that, you could change your mind. It is so easy to freeze sperm and to have it available for use in the future. Now, I know there's a cost to storage, but It's just something to consider. So before you do your vasectomy, think about freezing a sperm sample that you might be able to use in the future without a vasectomy reversal or without these other options. Just a thought. I hope you learned something from this video. I love educating on reproductive health. Like this if you learned something. Comment with questions that you have. Subscribe to this channel so you don't miss my weekly video, and stick around for more learning.